And our final speaker will be Leah Rolando, who's with Mental Health America of Wisconsin. She's the suicide prevention specialist there. She'll discuss Wisconsin's suicide prevention strategy and considerations for policymakers. So thanks, Leah.
Absolutely. I just want to say thank you, Lynette. We can't talk about suicide prevention without talking about identity. So thank you for being here and bringing those pictures as well of your event. So like Sam said, I'm Leah Rolando. I work with Mental Health America of Wisconsin as the suicide prevention specialist. So I'll give you a little bit of context about the partners we work with, our state strategy, and then I'll finish up with some policy recommendations. So Mental Health America of Wisconsin is just our state chapter of Mental Health America. We're part of the community-based, the nation's leading community-based nonprofit dedicated to helping Americans achieve healthier lives. And our core pillars are prevention services for all, early identification and intervention for those at risk, and integrated care and treatment for those who need it, with recovery as the goal. And through Mental Health America of Wisconsin, we administer Prevent Suicide Wisconsin under a contract with Department of Health Services, and we're a public-private partnership that came out of strategic planning in 2009. So we've been doing this work for a little while, and all of the people at the table are involved in this work. So it's really exciting to be here. I love my job. I love the people I work with, and we are all talking together, so that's really exciting. We work with county coalitions throughout the state, state partners including the Department of Public Instruction, Department of Health Services, the Office of Children's Mental Health, and Department of Corrections. And it's not just limited to that, so if you are interested in getting involved with the steering committee or any of this work, please talk with me afterward, and my information will also be at the end of the presentation. So we also host an annual conference, so that's happening in May of 2019, monthly e-newsletters for statewide resources. We have a website and quarterly steering committee meetings, so I can talk a little bit about the steering committee. So recently, something really exciting is we've been working with the Prevent Suicide Wisconsin Steering Committee is actually serving as the Healthy Wisconsin Priority Action Team. So we've kind of integrated our leadership and responsibilities. So those of you who aren't familiar with Healthy Wisconsin, Healthy Wisconsin serves as the State Health Improvement Plan and also the State Health Assessment. Members of both groups, we're an integrated group now, we've all been involved in providing feedback to the strategic planning process. And we're working to align our objectives for our messaging around suicide prevention and the updated state strategy. Another way that public health is involved, because suicide prevention is really a public health approach, and we work with so many of our local health departments across the state, and one way we do that is through the Adolescent Suicide Prevention Learning Community, through the Maternal and Child Health Block Grant Funds. So we're one of the learning communities, and we're the one focused on suicide prevention. So we know that in 2019 we will have 50 health departments involved, which speaks to the interest in suicide prevention work. We know those health departments are already doing work, and we want to give them the resources and the information to do more work in their local communities. And they also, a lot of our local health departments throughout the state participate in a lot of our coalitions, so again, connected in that way. And the strategies of the learning community align with our state strategy. They work on working with community groups in their communities, healthcare systems, and their local school districts. All right, so this slide kind of frames the Wisconsin suicide prevention strategy. This is all, the strategy informs what we do, and also what we do informs the strategy. So everything you've heard about today falls under these 4 main goals. And I have my strategy with me to give you a little more context. Goal 1 is increase and enhance protective factors. Goal 2 is increase access to care for at-risk populations. Goal 3 is implement best practices for suicide prevention within the healthcare system specifically. And goal 4 is improve monitoring and evaluation of suicide and suicide prevention activities. So some examples of these. The strategy's kind of vague, and there's a lot of examples, so I won't go through the whole thing. It's available on the Prevent Suicide Wisconsin website. But to really give you an idea of what activities fall under these goals, under protective factors, we work to create suicide-safe environments, increase social connections, and promote social and emotional development. So examples would be, on the wrong page, So safe storage, when we talk about creating suicide-safe environments, we have to talk about access to lethal means, so making sure guns are locked up, support groups, and promoting trauma-informed care, which is a lot of the work that DPI is involved with. Goal 2, access to care. That includes increasing the public knowledge of risk factors and warning signs. So we've mentioned QPR a lot, question, persuade, refer as a gatekeeper training. That's one example. Reducing stigma and promoting shared lived experience. So folks might be familiar with the Wisconsin Initiative for Stigma Elimination. They do trainings on stigma reduction. And on our steering committee, we have folks with lived experience that are working on messaging to the state. So how do we talk about suicide prevention and not just suicide? So thirdly, expanding services for mental health, substance use disorders, and suicide care specifically. An example of that would be working to enroll folks in health insurance to make sure that they do have that access to care when it's available. So goal 3, healthcare system best practices, increase resources for providers and improve our continuity of care. So a lot of that work, the increasing resources for providers, falls under our Zero Suicide Initiative in Wisconsin, which I'll talk a little bit more on the next slide. And then improving continuity of care is working with emergency departments and emergency department staff on better follow-up for people who have attempted suicide and aftercare when someone has attempted suicide. Lastly, under Goal 4, data monitoring and evaluation. Sarah's involved with a lot of this work. So you heard some of the burden of suicide report data. We work to describe the impact of suicide and improve that data collection process so that we have accurate data and we know when folks have questions about what suicide in Wisconsin look like, we have the answers to those. Identifying subpopulations at disproportionate risk of suicide and evaluate our prevention efforts. So some examples of those would be working with medical examiners and coroners, population-specific partners who might have different data than the data we already have access to. So I know Representative Ballwig mentioned the crisis text line, Hope Line. We can receive data through that, and we really know the youth that are texting, and we know what issues they're mentioning, what time of day. You mentioned that Tuesday we know is really high risk. And then also things like the Trevor Project also has a text line, and we could get data from that for subpopulations to increase the data that we have access to. And then evaluating programs for effectiveness. So that essentially means making sure all of these things we're doing, are they actually working and are they having an impact? So Zero Suicide in Wisconsin falls under our Goal 3, and we're really excited about this work in Wisconsin because Zero Suicide, for one, aligns with the National Strategy for Suicide Prevention nationally and its quality improvement in clinical organizations. So we have made progress in Wisconsin, we made progress nationally. We know that it has a huge evidence base and best practices. And a lot of the resources are already online. So once organizations go through a Zero Suicide training, they can access those trainings whenever they would like to. And we have links on our Prevent Suicide Wisconsin website for them to make that even more accessible. So some organizations have reduced their suicides 60 to 80%, and approximately 45 organizations in Wisconsin are trained in Wisconsin, and we have ongoing regional efforts that we are just looking to expand. So that's one of the examples of the work we're doing, and it is a key part of Mental Health America's efforts through the DHS funding that we receive. So we know that there are things we can do that actually are making a difference, and it's exciting to see Zero Suicide grow in Wisconsin. So this is kind of a large, I was going to say small snapshot of what our coalitions are doing, but our coalitions are doing a lot. And the message here is that we have been incredibly successful in getting our coalitions to align with the state strategy. So you can see I highlighted those objectives fall under Goal 1 and 2, and our coalitions are great at working on creating those suicide-safe environments, increasing social connections, promoting social emotional development, and increasing public knowledge and reducing stigma. And none of those are done alone. The coalitions report that they're working with their local health departments and their local school districts. And so this is from the coalition data that we get every year through the coalition surveys, and those are also available on the Prevent Suicide Wisconsin website if you're interested in more of that data. All right, so what is next for the Wisconsin Suicide Prevention Strategy? So this document was released in 2015, this one that I have up here, and we are working to update this. And it is an exciting conversation in our nation and especially in Wisconsin because we are adding partners and we are adding people to our steering committee, our priority action team, to help us develop this strategy in Wisconsin. So we obviously have a working strategy, but we want this to be a living, breathing document that's accessible to the people on the ground doing the work. And so we held a strategic planning in September to work on collecting our strengths, weaknesses, opportunities, and threats, and then collect some action items for statewide planning because we know there's always work to be done, and we don't want to just have this static strategy be limiting what we're doing. And so we've merged. Important announcement is that the updated report and strategy is coming in 2019, like Sarah alluded to, and then we will have an updated strategy as well. And so we've merged since then into a data surveillance group and a prevention content group. We're looking at exploring the creation of an online data dashboard, which would be accessible to anyone in Wisconsin if you would want to look at demographics, county level data, whatever we're able to put into that to make this data available to people in Wisconsin. And then the prevention content subgroup is working on updating our goals and objectives and framing the messaging. And the ultimate goal of all of this is to align and inform prevention efforts across the state to make sure we're working together all on the same page and we have an easy strategy to see. Easy is not the word, but simple to look at and understand what we're doing aligning with what we said we were planning to do. All right, so some policy considerations. We know that there are things that work, and so we really want to lay out, these are the things that we can do. We have a lot of options, and we have a lot of areas where we can make impact. So this one is this is school-based suicide prevention is one of the areas. Provide funding for school-based suicide prevention. So Greg and Kate mentioned the Signs of Suicide Kit, Sources of Strength, and Hope Squad. We have some data to show you what that would look like in terms of providing funding. All of those programs are school-based, peer-to-peer, youth-led, adult-guided programs. And again, that statistic about 32% of youth disclose their intent before a suicide. So when we know that kids are reaching out to other kids, we need to equip them with this training and with the knowledge about what to do. And then another option would be grants to help implement behavioral health screenings to identify and intervene with students at risk. So we know some schools do screenings, not everything is uniform, and grants would really help staff that and also help do the screenings. Right, so these considerations are around statutory requirements for training. Greg laid out what we have in Wisconsin. We have a lot to offer. We're not requiring the how, though. And so we just wanted to share this information that 27 states plus DC already do require training for school personnel. 9 states require training for health professionals. We know that many states are already doing this, and if policymakers are interested in this, there are things that already exist that we could fund. And so this isn't recreating anything. There are things that we could underwrite. We could underwrite training costs to encourage more participation for school personnel. An example of that, at our Prevent Suicide Wisconsin conference, we host a pre-conference training called Assessing and Managing Suicide Risk, and a lot of school personnel attend that. And sometimes schools are able to reimburse and sometimes they're not. And so underwriting that part of the training cost would increase participation and school staff would be trained. And we can't talk about suicide prevention also without talking about access to lethal means. So a few facts that I would like to share is that while guns are not the most common means of suicide attempts, they do result in more deaths than every other method combined. And we know that people die 82.5% of the time. And the myth out there is that if people really want to die by suicide, they're going to find a way to die by suicide. I mean, that's not ultimately true, because we also know that 90% of people who survive a suicide attempt don't actually go on to die by suicide. So when a crisis is so brief, it's important to have guns locked up, medications locked up, and to have some of these protections in place. And another public health study has shown that laws requiring gun owners to store their firearms with the locking device are associated with 68% of fewer gun suicides per capita than states without them. So this is an important piece of the suicide prevention conversation. So you can see some ideas up there, and I also have documents on some example state policies. Some final considerations for policymakers. I know this slide has a lot of information, but there are more things we can do. Specifically, increasing the mental health workforce. You could also increase the loan repayment program, support integration of behavioral health providers into primary care. We know that's been effective in other states. Grants for coalitions and local health departments to increase public awareness and implement local programs. So we know our coalitions are doing things, but we know most of our coalitions are volunteer-led and ran, and so there isn't a lot of staff capacity, and a lot of times not a lot of volunteer capacity either. And if there are funds to support those grant programs, there needs to be funds to support the administration of those grant programs. Val mentioned staffing prevention work, so making sure we have the people who can carry out these projects and programs. And then lastly, funds for populations at disproportionate risk of suicide. So when we talk about farmers, when we talk about veterans, LGBTQ youth, we know that suicide prevention programming isn't a one-size-fits-all. And so if we could connect the people who are already doing the work in their community with the resources for folks at disproportionate risk of suicide, we know that we can make an impact. So those are my final policy recommendations. If you have other questions, you can contact me. There's my email and the Prevent Suicide Wisconsin website. So thank you so much for being here.